Recovery after surgery can be slow, and as tissues and muscles heal, it can be painful. In today's Health Watch, Local 3's Connie Fellman shows us how doctors are helping patients manage pain while decreasing the opioids they prescribe.
Every day in the United States, 130 people die from an opioid overdose. Sometimes the drugs are obtained illegally, or they can be prescribed by a doctor for pain relief after surgery. In the wake of an epidemic of opioid addiction and deaths, there's a growing movement among surgeons to find other ways to successfully manage post-surgery pain.
OxyContin, Percocet, Vicodin. For years, they were a mainstay of pain management after surgery. Plastic surgeon Lauren Negro says she and many of her colleagues recommend non-narcotic alternatives for patients, even for procedures that require weeks of recovery time, like a tummy tuck.
A lot of it has to do with the size of the cuts we're making, and a lot of it has to do with also sewing those muscles together.
But Dr. Negro says for the past several years, there's been a movement to treat pain before, during, and after the procedure. Before, patients are often prescribed Tylenol or other acetaminophen for several days. During, doctors administer a long-acting nerve block that can last 3 or 4 days. After, doctors sometimes prescribe the non-opioid gabapentin, non-steroidal anti-inflammatories, and in some cases, an injection of Botox.
There's actually a substance in it that it inhibits the substance P, which involves the pain pathway.
Dr. Negro says it's important to use the pain management methods before and during surgery, so patients are not suddenly in uncontrollable pain after, which leads to taking more than needed.
Doctors do still prescribe opioids for pain relief and chronic conditions, but in some states, doctors limit the prescription to just 10 pills or just a week's worth of medication. And that's your Health Watch. I'm Connie Fellman, Local 3 News.